The opinions expressed are those of the show's host and not the staff or management of Port St. Lucie Broadcasters. Any reproduction without written consent of WSTU and WPSL is strictly prohibited. Now it's time for Quality of Life Radio, brought to you by Cigna and Aetna Medicare. Here are your hosts, Gary Owen and Tom Bouvier.
Hello and good morning, everybody. Thank you for tuning in on the world-famous Quality of Life radio show. My name is Gary Owen. I'm the president of Owen Insurance Group and your extraordinary, talented, handsome host of this famous show. And today is Tuesday, October 24th. And I am happy to have my co-host extraordinaire with us as well.
I'm your co-host extraordinaire, Tom Bouvier.
And Tom, we are streaming live on Facebook, so we want to give a shout out to all of our friends who are tuning in on Facebook. If you're tuning in on WSTU 1450 or WPSL 1590, thank you as well. But you can always follow us on Facebook at The Quality of Life Radio Show. And to our friends listening in around the world, you're tuning in on Alexa, on TuneIn. So thank you all very much for being with us today. And we're here, Tom, every single Tuesday morning.
Yes, we are, Gary. We love to bring a half-hour entertaining show, but filled with content that people can actually use. This is information and content that can actually change your life and potentially even save your life.
Absolutely.
Based on the information we share. Because you and I, we've been in this industry a long time, combined for many, many years, and we share our knowledge. We present information about important insurance planning, the solutions, all the pitfalls to avoid, what to look out for. We bring you transparency and good old-fashioned straight talk. We call it the no-plop zone. You're not going to get any BS here. We want to improve your quality of life through the education and information and potentially the enrollments into an insurance plan for you. And it is the mission at Owen Insurance Group to simplify insurance planning so that you could live a stress-free life.
Every day, Tom and I go into battle.
Yes, we do.
We open the doors to Owen Insurance Group, and we're always here as a resource. We're always trying to figure out ways to help our clients to live a better life. And again, by simplifying insurance planning so you can enjoy the stress-free life that you deserve. So we're going to get in today. We're going to be talking about the new 2024 Medicare Parts A and B premiums and deductibles. So we're going to talk a little bit about that today. Before we get started, though, we're going to do the quote of the day. And, Tom, why don't you be brave and do the quote of the day today?
All right, here we go. So the quote of the day is actually this. It says, be brave, be wise, and always trust your gut. Intuition goes before you, showing you the way. Emotion follows behind to let you know when you go astray. Always trust your gut, your instinct. That's so true. Boy, and I saw somebody talking the other day about the situation. They were saying, I am going to let myself cool off because I am so emotional right now. I know exactly what I want to do, but my reason and my logic and my intuition and my gut is telling me don't do all those things. Many times our emotion gets the best of us, and we're all human, but be wise and be strong.
And sometimes it's good to sit back, take a deep breath, before you send that hot email off.
Or that text message.
Or the text message off, or verbalize something sometimes. I'm sure we've all been there. I've been there before.
No way.
And I wish I could have taken an email back that I wish I hadn't sent, or said some things I wished I hadn't said. There was a wise man once. It was an Indian chief. It was talking to his son, and they were, the son had said some words, and he told his son, gather all the feathers you can, put it in this burlap sack, and then we're going to go on top of the mountain. So the son spent a whole entire day getting all the feathers he can get, put it in a bag, and it was a very windy day. And he said, okay, son, I want you to take the feathers of the bag and then put it into the air and just let it go. And the son did that and watched the feathers just going hither, all four parts and corners of the earth. And he said, when you speak words, The words are like feathers. You can never get them back again. Very wise man.
Yeah.
Very wise chief. And that was a very powerful moment for me, knowing how important that words can be. So anyway, that
good.
was a great quote of the day. Today, as I said, Tom and I are going to talk to you a little bit about the Medicare Part A and B premiums, the deductibles, and so forth.
And Irma even came out as well.
And also,
Irma, yeah.
those of you who are on Social Security is going to get another increase of 3.2%. So congratulations on getting another pay raise. That's multiple years in a row now. So congratulations to those of you who are. And I know it's needed because, this past year was a crazy, crazy year for inflation. Oh my God, was it crazy? So
More than 3.2%.
Much more. I know it was up to 9% out for a while there. It was just out of control.
Yeah.
But anyway, so Tom, let's talk a little bit about the Medicare Part A and Part B premiums. There are many that may be listening to our show here today, this morning, who may be aging into Medicare, and they don't know where to go, who to turn to. I can tell you unequivocally, there's one company you should be turning to, and that's Owen Insurance Group. And we are here as a resource and to provide you unbiased information and support, because here is the no plop zone. No BS happens here. So if you want it straight, give us a call, 772-210-1020. We do have a brick and mortar location. So, obviously we're not a fly-by-night company. We're here. I've been here on the Treasure Coast for 38 years. We are going nowhere. The sand is in my flip-flops. So we're here for the duration, and we're here to provide support. All right, so Medicare Part A. So, well, first of all, those of you who are aging into Medicare, real quick, let's talk about that. Tom, where do they go to sign up for Medicare? Do they call Medicare to sign up for their Medicare?
Well, actually, they would not, Gary. You would think Medicare would make it a little simple. Call Medicare, 1-800-MEDICARE. But no, you do not. Two things, however. If you were under 65 and you were drawing Social Security benefits, maybe you got it early at age 62, as you approach the age of 65, 3 months before your birth month, you will get in the mail your Medicare card. So you actually do not have to apply for Medicare. You'll get Part A and Part B, and your Part B premium will be deducted out of your Social Security benefit. However, if you are not drawing your Social Security benefits, whether you're retired and just don't want to initiate your Social Security benefit, or you're still working, you would have to apply for Medicare Part A and Part B. So us at Owen Insurance Group, we are very familiar with helping people, guide them to where they can apply. You can call Social Security. Again, it's not Medicare, you would think. Call your local Social Security office, go on ssa.gov, and then click on the part that says sign up for Medicare. You can do it online, and you can even come to our office, and we can kind of walk you through it right on the computer. Or you can call Social Security 1-800-772-1213 and set an appointment, typically to go in and see and apply in person.
And Tom, we know that Medicare beneficiaries love paying the Part B premium and Part A premiums. Today, we had a client come in today who didn't get their 40 quarters in. So 40 quarters.
That doesn't mean the little quarters.
No. These are big quarters.
Yeah.
You got to have
3-month quarters.
40. So if you're looking to get on Medicare and have a premium-free Part A, you need 40 quarters of work history or 10-year work history. So you don't have to pay the $504 Part A premium. However, in 2024, it's going up to $505, $1. But it's based on how many quarters you have worked, your work history. So if you have, at least 30 quarters of coverage, were married to somebody, then your premium would be $278. Less than 30 quarters work history, then you would have the full premium of $505 to pay for 2024. So keep that in mind. So for those of you that have a 10-year work history, or maybe you have a spouse that you didn't work, you don't have a work history, but you're relying on your spouse's work history, again, you would have a premium-free Part A. And again, that is equivalent to $505. That's nothing to sneeze at. And then Part B, Tom, we know that Part B is going up for 2024. How much? Is it a lot of increase?
Actually, no, it's not a lot, Gary. It's going up an increase of $9.80. The standard rate that the majority of Americans pay for their Part B premium is $164.90. That's going up to $174.70 for 2024. So in January, if you are currently on Social Security, of course, Gary mentioned you would be getting a 3.2% raise in that Social Security benefit, but your premium, and you're on Medicare, your premium will be deducted from that Social Security benefit check. It'll be $174.70 instead of the $164.90.
So their 3.2% increase in the Social Security check will more than cover their $10 increase.
I believe it should.
It definitely will.
Yeah, it definitely will.
All right. Now, there are 6 different tier levels when it comes to your Part B premium. Do you prefer to pay a Tier 1 level, or do you prefer to pay a Tier 6 level? So when I call it the Tier 1 level, that means that if your income, your household, you're married, you're filing jointly, then your basic premium, your basic Part B premium, what I call Tier 1 premium, is $174, right? $174.70 for 2024. So that's called IRMA. So we're looking at an IRMA chart, income-related monthly adjustment amount. So if you're a high-income wage earner, then you're going to be paying more for your Part B and Part D premiums. So the highest is Tier 6. If your income is more than $750, if you're married filing jointly, then you're going to be paying, instead of $174.70, Tom, how much are they going to pay?
You are going to be paying $515.
$594.
Oh, $515. Oh, I'm sorry, I got the wrong chart there. Sorry about that. That's a different one. Yep, $594.
So if you're, and by the way, if you're not married and you're an individual that's filing alone, single, if your income is $500,000 or more, same thing, that's equivalent as the married at $750, you're paying $594 for your Part B premium. So, and again, you will also have a Part D premium to pay as well. So keep that in mind for 2024. Now, go ahead, Tom.
Okay, so there you go. So that's the Part B premium.
What about the deductible? We want to cover the deductible.
I sure do. So the Part A deductible, the Part B deductible, that's the one the majority of people definitely use, because Part B covers the medical expenses, doctor visits, outpatient, emergency rooms, things of that nature. Most people would use that before going into a hospital. That's covered under Part A. But the Part B deductible this year has been $226 for 2023. It's going up by $14 per month, so that'll be $240. So if you're on a Medicare supplement plan and you're used to having that first of the year deductible, it's going to be $240 out of pocket for your Part B. And if you're on a Medicare supplement plan G, you'll pay nothing after that. But
yeah, so that's a great point about the Part B deductible, because when you're thinking about a $240 a year deductible, let's say you're on Plan G on a Medicare supplement. So for those of you that are aging into Medicare and you're like, okay, man, I've heard different Medigap plans, there's Medicare Advantage plans. So Medicare supplement, you're basically in control of your health care. You're on original Medicare. You pick up a supplement. Plan G will cover 100% of what Medicare doesn't cover once you hit the Part B deductible of $240. Mm-hmm. So that is going to be your most comprehensive Medicare supplement plan. If you're on a budget, you love Medicare, original Medicare, and you want to be in a supplement plan, but you're on a tight budget, then, Tom, we recommend the high deductible G plan, or the Plan N. One of those two will fit perfectly for your needs. And the premiums for the high deductible are low as $50 a month here in Florida, depending on if you're male or female and what zip code you live in. So very, very affordable. And the deductible for the high deductible G plan is going up to $2,800 rather, excuse me. $2,800 is your maximum out of pocket for 2024 on the high deductible G plan.
And some people are thinking, wow, that's low because I'm on a plan right now with my company and I have a $5,000 deductible or a $10,000 or whatever. So these are very reasonable and still having the freedom of a Medicare supplement. So
freedom
the high deductible
go
plan.
Where you want to go without networks.
And without referrals.
No referrals, no pre-authorizations, no limitations. If the doctor says you need to have hip surgery, you're going to have hip surgery. No pre-authorizations, no obstacles to be in your way, right? It's a little bit different than being on a Medicare Advantage plan. So it's important that you know the difference between a Medicare supplement with original Medicare versus a Medicare Advantage plan or managed care. So people don't realize if you go on a Medicare Advantage plan that you are opting out of original Medicare, your A and B. You're no longer going to be using your Medicare card, but you're going to be using the ID card of that carrier. So,
right.
And most people get it, confused. They say they're on a Medicare supplement plan. Come to find out, when we ask, well, how much premium you're paying, when they tell us zero, we know you're not on a Medicare supplement. You're on a Medicare Advantage plan. Very important that you know the difference between the two and know that if you choose to go on a Medicare Advantage plan when you turn 65 and down the road, if you want to go to a supplement plan, now you'll have to qualify with health underwriting. So if you have a pre-existing condition or a chronic or a critical illness, you may never probably be able to qualify to go on a supplement plan. So, Tom, it's important that they make the right decisions because they may be stuck in a certain plan that they start out with when you turn 65. So give us a call at 772-210-1020. If you have questions or you want a review done, we're in the middle of the Medicare annual enrollment period. We can review your existing plan. If you're turning 65, we can go over all of your options, and you owe it to yourself to give us a call because, again, this is the no plop zone.
That's right.
We'll give it to you straight, without bias. See, we are your guide. We'll show you all your options. We'll teach you, we'll train you, we'll educate you, but it's up to you to make that choice what's best and most suitable for you. So again, make sure that you choose the right plan. And whether you're new to Medicare or you're already on Medicare, and a lot of people don't want to make a decision during the annual enrollment period. They're getting inundated. They're seeing these bloody TV commercials. They're getting sick and tired of it. Listen, we get it. We understand. And then we make it easy because we're local. We're your neighbor. We're going to give it to you straight. And then we're not going to badger you, right? So if you want to get a review done, we don't charge for our services. You can go to www.aep2023.com, put in your information, fill it out. One of our friendly staff members will give you a call and schedule an appointment. We'll talk to you about what plan may be most suitable and recommended for you because plans change every single year.
Yes, they do.
Especially when it comes to Medicare Advantage and prescription drug plans. So there are some new drug companies, or new drug plans, new Medicare Advantage plans, different maximum out-of-pockets, drug deductibles, where there never used to be a drug deductible. Before there used to be tiers 1 and 2 and tiers 3. Didn't require you to hit the drug deductible first. Now, because of the Inflation Reduction Act, some companies now are making you pay the deductible first. And then there are some drug companies that are including tiers 1 and 2 without having to hit the drug deductible. And then there are some drug companies that have increased their premiums to 40 to 100%, where one specific drug company has lowered the premium to $0.
What?
So
Yeah.
if you don't know, you could be in a lot of problems moving into 2024 if you don't have a drug review done or a Medicare Advantage plan review done.
Absolutely. And I'm sure everyone listening out there has already read their annual notice of change, and that would have come to them in the mail before the October 1st. That's annual notice of change is a document that Medicare requires these carriers to send out for your prescription drug plan or for your Medicare Advantage plan, and they're letting you know what changes for 2023. If you think you didn't receive it, or you didn't read it, or you picked it up and tried to begin to read it, and you got a little confused, listen, we're here to help. You're not going to have to pay for anything. You're not going to get anything less, and you're not going to have to pay anything more by allowing us to help you. We're local brokers. We're fiduciary. We're going to lead you and recommend only what's best for you. And if we find a plan that may be more suitable for you, we're going to make the recommendation. And if we enroll you in it, that's how we get paid. So,
oh, wait a minute. We don't want to charge them? If we give them good service, we can't charge them extra money?
Well, we can't. As much as you might want to try to pay us, and I've had clients pull out a checkbook, how much do I owe you?
Sure.
I said, listen, I get compensated by the insurance company, or even if I don't enroll you, it's just what we do. We're like real estate agents. We show you the bunch of houses, and if you don't buy from us, through us, then that's just the way it is.
I think even more important than buying a home, Tom, is enrolling in the right Medicare plan that's going to protect their quality of life and their quality of health, because you can't put a price tag on that.
No, I'm fond of saying your health is your greatest wealth.
You better believe it.
I mean, you may have your nice big $500,000, $1 million home and think that or that big boat is your greatest wealth, or all your big bank accounts, and all that's nice and that's wonderful. But when it comes down to it, your health is your greatest wealth. Every rich person will tell you that. So
you can't put a price tag on that.
You can't.
So today, earlier this morning, we had a client that she's on a Medicare supplement plan, and she's having some struggles in paying her bills. And, of course, part of that is her Medicare supplement plan. So she asked about, and she's in her 70s and always been on a supplement plan, loves her supplement, but having a hard time with the budget. So she's considering going to a Medicare Advantage plan, which she did do this morning. So, and I was instructing her, and today I'm going to tell you that it's very important that you understand, if you've always been on a Medicare supplement from the time you turn 65, and now let's say you're 71 and 75, whatever that age is, and you want to go to an Advantage plan, there's something called the Medicare Supplement Trial Right Period. So if you're on a Medicare, as to say you switch from a supplement, you want to try out this Medicare Advantage plan, it's $0 premium. You still have copays, you still have deductibles, you still have max amount of pockets to pay. You have networks to contend with. You got pre-authorizations to contend with, and you may have claims that might get denied, but this is Medicare Advantage. So you have a year to try that out, and before the 12th month is up, go back to original Medicare and pick up your original supplement plan without any problems. So keep that in mind. If you have a supplement, you're having a hard time paying it, you want to try out the Advantage plan, you do have a Medicare supplement trial right period, as you have a Medicare Advantage trial right period. When you're 65, you're aging into Medicare as well. So these are the things that Tom and I have the experience on, that we can help and guide you and put you in the right plan that makes the most sense for you. So at Owen Insurance Group, all you got to do is pick up the phone. The call is free, Tom.
Woohoo!
772-210-1020. Or go to www.aep2023.com. And you can have a free review done. We'll take a look at what you have, take a look at your drugs, the formulary, your doctors, and then we will find the best plan for you. This one agent that this lady came to me today, talked to, had her in a different plan that I recommended, and didn't realize that she was going to have about $800 more a year in drugs at a cost out of her own pocket if she'd went with this other plan that the other agent recommended. So again, because we are independent agents, we have these capes that we wear.
We do.
We're superheroes. And we are going to go to work for you. We will do all the heavy lifting for you. We do all the research, and we come to you and let you know, here is our recommendations. So, again, we're here as a resource. Tom, any final words?
Yes. Gary, I like to let people know, Owen Insurance Group, we don't just service people in the state of Florida. We love Florida. It's our home state. However, we're licensed in almost all 50 states. So if you have family in North Carolina, Georgia, just all up and down the entire beautiful, from sea to shining sea, give us a call. Either we are personally licensed or one of our agents are.
Perfect. Yeah. All right. Well, I've been given the finger. 1 minute left. So stay tuned. Coming up next is a Brian Kilmeade Show. We thank you for tuning in with us this morning. And please share us with your friends, family, and neighbors. Let people know that we're here as a resource here in the Treasure Coast. And remember, stay safe, keep healthy, be happy, but most importantly, enjoy your quality of life.